Good morning. I want to thank the elected officials and county leaders who are joining us today. First of all, our Senator, Dick Durbin, Dr. Ponni Arunkumar, our Chief Medical Examiner, Dr. Israel Rocha, Cook County Health, Avik Das, Executive Director of the Justice Advisory Council, Dr. Farhan Bukhari, Chair of Trauma at Cook County Health. Thank you all for joining us. I'm grateful. June is Gun Violence Awareness Month. President Biden addressed this issue just last night. And right now, we're grieving multiple tragedies in Buffalo, Uvalde, and Tulsa. In Chicago, over Memorial Weekend, just last weekend, at least 42 people were shot and 9 were killed. 42 people were shot and 9 were killed. Last year in Cook County, there were over 1,000 gun-related homicides. Gun violence is a local and a national problem that has only gotten worse since the onset of COVID-19. Nationally, gun homicides have increased by 35%. And now, gun violence is the leading cause of death for children and young people under the age of 25. In Cook County, we've planned a series of major investments this year that will increase equity and address many of the root causes of crime and violence in our communities. First, we established a $50 million Cook County Equity Fund to explicitly address the historical disinvestment and continued disparities that impact Black and Brown communities. Some of the initial initiatives address access to affordable housing and provide vital reentry support for justice-involved residents returning to their communities. Second, our Justice Advisory Council, led by Avik Das, who you'll hear from shortly, has been funding evidence-based violence prevention programs for the last decade. In response to the high levels of gun violence we've experienced during the pandemic, and with funding from the American Rescue Plan, we're investing an additional $65 million in these life-saving, community-based programs in areas with the highest levels of gun violence. While we were planning this investment, we knew that working with the City of Chicago and the State of Illinois would be critical to our success. So we formed an intergovernmental working group to address gun violence. Through this vital partnership, we're now able to maximize our collective resources and broaden and deepen our support for those in the community. Finally, we are using American Rescue Plan funding to support healthcare initiatives related to gun violence. We'll be expanding our Healing Hurt People program, based out of Stroger and Comer Children's Hospitals. This trauma-informed violence prevention program breaks cycles of trauma caused by gun violence by supporting victims during and after their time in the hospital. We will also vastly expand personnel and mental health support at existing Cook County Health clinics. This support will serve as a bridge to meet immediate needs while we create a new Department of Mental Health Services at Cook County Health. This historic investment has the potential to truly change lives. These are just some of the initiatives we've planned. To learn more about how Cook County is addressing gun violence and community violence, visit engagecookcounty.com/violence prevention. Throughout the month of June, we'll be sharing how we are working to build safe and thriving communities for all our residents now and for the future. Gun violence prevention is a growing movement that is literally saving lives. This work is not easy. It takes expertise, commitment, courage, and heart. And I want to express my appreciation for our outreach workers, case managers, social workers, mentors, and first responders who are working on the ground to support our at-risk neighbors and youth. As a mother, as a grandmother, as a teacher, the recent mass shootings in Buffalo, Uvalde, and Tulsa, and the ongoing violence in Cook County feel very personal. But awareness is not enough. We'll continue to address the systemic factors that led to this crisis and advocate for effective gun safety policies at all levels of government. Together, we can build a safer Cook County. Thank you. Now I'd like to bring to the podium our U.S. Senator, our senior U.S. Senator, Dick Durbin.
Thank you, Madam President. It's an honor to be with you today. This week, it was a hospital in Tulsa, Oklahoma. Last week, it was a grade school in Uvalde, Texas. The week before, it was a grocery store in Buffalo, New York, and for over 200 different occasions, we have had mass shootings this year already in the United States of America. This morning, I spoke to a fourth grade class at a Chicago public school. Some of the cutest, sweetest, lovely kids imaginable. I couldn't help but thinking, those are exactly like the kids in Uvalde, Texas. Got up this morning, parents made the lunch, took them to school, but in Uvalde, Texas, they never came home. One of the things that is part of this equation is the deadly weapons which we allow to be sold in the United States virtually with impunity. Yesterday in Tulsa, or 2 days ago in Tulsa, Oklahoma, a disgruntled patient, angry with the outcome of a surgery and the treatment by a doctor, went out and literally bought an AR-15 semi-automatic weapon and the ammunition, returning to the hospital 2 hours later, killed the doctor and 3 or 4 innocent people. That is how easy and accessible these weapons are. And the AR-15, make no mistake, is not a sport rifle. It's not a hunting rifle. It is a deadly military weapon. It was brought to the United States after we settled on this as the weapon for our soldiers to take into combat. Well, we know what happened in those cities. It's been reported over and over, a devastating impact. But as President Preckwinkle said, it's happening on the streets of Chicago and the streets of New York and the streets of America almost every day. And what's happening is that these deaths, 9 on the Memorial Day weekend here in Chicago, are despite the valiant efforts of the medical people, the professionals who are here today. Consider this for a moment. I helped to set up a program so that the United States military can come to Stroger Hospital and see the emergency room activities of these professionals saving gunshot victims. They thought this was close to a model of a war zone that they could use to train our military surgeons to save men and women in battle. And they picked this great city, and sadly, the many victims that we have of gunshots. What can we do about it? Well, first off, there is no excuse for Congress not acting. The American people, if you don't get the right response, need to respond in the election in November. That's what a democracy is all about. Elect people who really care about gun safety, and make sure if it's an important issue to you, you make an important issue to the candidates. Secondly, we've got to do what we can even in a 50-50 Senate, and it isn't much. It doesn't get anywhere near where I would go if I had the power to do it myself. But to move in the direction of making America safer is so long overdue. It is important that we do it now. And third, an element that was raised by President Preckwinkle, which I've been focusing on in federal investments here in Illinois and in Chicago and across the nation, is care for those who have been affected by the trauma of these experiences. Trauma is more than a physical injury. Trauma is a life experience which changes the mind, changes the body, and changes the lives of the people who've been victimized by it. Trauma care, making this an important part of the diagnosis, is key to making sure that we have a generation that doesn't turn to guns to solve their problems. This is Gun Violence Day, Gun Violence Week. Sadly, it's Gun Violence Year in America, and it's been that way for too damn long. This gun violence has become so common that it defines our country. It's time for us to say enough as Americans, as voters, as people who really care for one another. Dr. Arunkumar, I hope I pronounced your name, Arunkumar, did I do it? Arunkumar, thank you. I'm sorry I messed up your name.
Before she comes to the board. Thank you. Thank you, Senator Durbin. I just want to thank you not only for your leadership on this issue, but your help and support for Cook County and Washington, and your good work on behalf of the people of Illinois. Thank you.
Sorry I messed up your name.
Thank you, President Preckwinkle, for your leadership on this very important issue. My office sees the devastating effects of gun violence every day. I would also like to thank Senator Durbin, Israel Rocha, Avik Das, and Dr. Bukhari for their efforts in addressing this crisis. We closed the book on 2021 with 1,092 homicides. A full 92% were gun homicides. 1,005 lives in this county were taken with guns. As I stand here, 5 months into 2022, close to 90% of the homicides in this county so far are a result of gunshot wounds. That's 289 of the 331 homicides confirmed since January 1. While we're grateful that we're seeing a slightly less number of homicides than last year, we're still ahead of 2020 levels. Most of these deaths are occurring in the south and west sides of the city. This year, more than 95% of the deaths are in our communities of color. 80% are African American, over 15% are Latino. Overwhelmingly, men and boys are the victims of gun homicide. Women and girls make up 14% of these gun deaths. The youngest victim of gun violence this year was an 8-year-old girl. The oldest was a 79-year-old man. 28 of our county's gun homicides this year were children under the age of 18. 103 of the gun homicides this year were in young people under the age of 25. 204 of the 289 gun homicides this year were in people younger than 35 years of age. We're senselessly losing our young people. The homicide rates we saw in 2021 were the worst since the mid-1990s. This year again, we've set up a record where we're over the number of gun homicides in 2020 by more than 100. I often say that the deaths that our office sees are largely preventable. I can say with complete certainty that every single gun death that we see is absolutely preventable. Thank you. Next, we have Israel Rocha, the CEO for Cook County Hospital.
Good morning, everybody.
Good morning.
Very happy to be here with you, but not happy to be here on these circumstances. I'd like to start to thank Senator Durbin for being with us today on our Wear Orange Day to recognize our campaign and pledge to hopefully bring an end to gun violence, to discuss the impact of gun violence in our country, and most importantly, want to thank the Senator for his leadership in helping to address this public health crisis. And in Cook County Health, and Cook County was one of the first to designate gun violence as a national public health crisis, and we believe that it is. I also want to thank President Preckwinkle for her dedication to address this issue, for providing critical funding to, in fact, enact needed change. To my colleagues at the Justice Advisory Council and the Medical Examiner, thank you for the important work that you do and for finding ways to bring many solutions to this urgent issue. I'd also like to recognize our commissioners for their steadfast support in helping to highlight the need to bring an end to gun violence and to have our health system be integral in that effort. It seems that every day our nation is grappling with yet another tragic and preventable mass shooting. In the first 152 days of this year, there have already been more than 200 mass shootings across the United States. Now, to repeat that one more time so that you can remember the gravity of what we are doing. In the first 152 days of this year, there have already been more than 200 mass shootings across the United States. Gun violence is one of the most pressing public health issues and threats of our time. Every year, 100,000 Americans are injured and 45,000 are killed by guns. Black and brown communities are disproportionately impacted by this violence. Guns are now the leading cause of death for children, surpassing motor vehicle deaths in 2020 for the first time in our history. We cannot, as a nation, let this trend go unaddressed. Generations of lives are at stake. Our lives are at stake. And if what can be made clear is that no one is safe. This is a public health crisis that strikes at every community, at every corner of our country, and every family is at risk. This is not an issue about whether we need to discuss or examine policy from different issues. It is an issue that is affecting every life and every individual that we can think of. We need comprehensive approaches to address gun violence with the same vigor used for COVID or to address other national public health crises that have confronted our country. This includes research rooted in science on gun-related morbidity and mortality to understand gun violence and formulate powerful interventions. I'm proud to say that at the direction of President Preckwinkle, Cook County Health has asked every single division within our hospital, our health system, from our CIRMAC division on correctional health to our public health department, to our managed care plan, to our physicians and our clinicians, to find new ways to help bring solutions to the fight against gun violence. And I'm confident that we will have new innovations to announce shortly. In addition to the work that President Preckwinkle has already addressed, the creation of a new behavioral health, mental health agency within our system, being able to bring new programs to bear, funding programs with our community-based organizations, and engaging our communities to find the very root of the causes that are leading for gun violence to occur. We also need to address factors associated with gun violence, from bullying to drug abuse to mental illness. All must be addressed, and they shall not remain unresolved. We also believe that prevention is the best way to help address the public health crisis. Common sense gun regulations such as background checks, waiting periods, and a ban on assault-style weapons with high-capacity magazines are part of this prevention plan. It is a public health plan. We ask individuals to stand with us in this prevention of helping to stem the tide on a public health emergency by enacting reasonable and measured public health solutions. Similar to common sense regulations applied decades ago to cars by the ways of speed limits, seatbelt laws, and requiring safety features, they do not intend to abridge an individual's ability to have certain rights. They simply aim to protect the lot of others to help to live their lives. Dr. Bakari will share with you, and you will see that we see far too many patients from extensive gun injuries. It has made our trauma surgeons amongst the best in the world at treating trauma wounds here at Stroger Hospital. And you heard the Senator discuss that we do work in partnership with our military to help to train other individuals to know what it is like to help address these injuries. And while we are proud that we have been able to accomplish great medical excellence in this field, we would be prouder to say that we no longer need to have this service at our hospital. We are proud to heal patients suffering from injuries, but we would rather help create a world where patients no longer need to suffer devastating gun-related injuries. Every day, our team is working to figure out what we can do to help the parents of our patients, to help the children who are our patients, to be safe, to simply live, to enjoy the simple acts of going to school, attending a concert, or even walking in the park without fear of becoming a gun-related victim. These are the stakes of the public health emergency before us. I have faith that working collaboratively to end gun violence and with the guidance of great leaders like President Preckwinkle and Senator Durbin, we can address this public health crisis. Senator Durbin and President Preckwinkle and our team have been laboring for a very long time to help address this, but now is the time that we need everyone to join our effort. Public health emergencies don't get resolved simply by providers. It takes a community to make this happen. Our desire to wear orange today is a call for everyone in America to stand with us. Public health is everyone's concern, and we ask you to join us in making this our moment, to stand united as a nation to say that we will bring an end to this public crisis. We ask everyone to join us in taking actions at every level, in ways big and small, to bring an end to gun violence, to gain a grip on this pandemic that is gripping our nation and making us unsafe. I want to say a few words in Spanish. La violencia armada es una de las más asmadas de salud pública más urgente de nuestro tiempo. Cada año 100,000 personas resultan heridos, 45,000 mueren por armas en fuego. Las comunidades afroamericanas y latinas se ven afectadas de manera desproporcionada por esa violencia. Las armas son ahora la principal causa de muerte de los niños, sobrepasando las muertes por vehículos motorizados en el año 2000 por primera vez. No podemos, como una nación, dejar esta tendencia que se quede abordada. Necesitamos un enfoque integral de la salud pública para abordar la violencia armada que incluye una investigación científica, abordando los factores de regreso asociados con la violencia armada, como las enfermedades mentales, y hacer regulaciones de armas que tienen un sentido común. Tengo fe que al trabajar juntos para hacer fuerte a la violencia armada, nuestra nación puede obtener la voluntad política y los recursos para abordar esta crisis pública. We need your help. Please wear orange today to symbolize that you stand with us in our effort to end this public health crisis. We thank our leaders for their leadership, and I am happy to bring forward Dr. Farhan Bukhari, our Chief of Trauma here at Cook County Health. Thank you.
Thank you, Mr. Rocha. Good morning. My name is Dr. Farhan Bukhari. I'm the Chair of Trauma at Cook County Health. Last week, as the news broke about the tragedy in Uvalde, I was, as many people were, saddened. We had barely comprehended the violence in a Buffalo grocery store that took the lives of 13 people. We tend to react with these news events in cycles. There's sadness, then anger, and disbelief. We think about changing but do nothing. And then we move on until the next one. This is a cycle that's been repeated several times in the last decade. Unfortunately, it seems the cycle gets shorter. Since Uvalde, there have been more than a dozen mass shootings, including this week at the hospital in Tulsa, as was mentioned by other speakers. As a country, we suffer from violence fatigue and a sort of a Stockholm syndrome, an acceptance that somehow that death and injury caused by guns is unavoidable and acceptable and that nothing can be done. That seems to be the predominant feeling in the United States. That is not true of my colleague trauma surgeons in Europe. I have been a trauma surgeon for 25 years, and you do not become numb to the violence and loss of life, but you do become numb to the public response and the lack of action. We are fortunate that medicine has so advanced that if you arrive on the doorsteps of this hospital, the trauma center at Stroger, with a heartbeat, there's a very good chance you will survive. But the reality is that surviving is only the beginning. Most people do not consider what happens after. The lifelong injuries, both physical and mental, that people will contend with for the remainder of their lives. And sadly, as much as our medicine to repair gunshot wounds has advanced, so too have the guns and the bullets. While we can fix the bullet holes and work to repair the injuries left by a typical handgun, bullets from semi-automatic or high-powered rifles, assault rifles, can leave damage so extensive that it's impossible to repair. There's nothing left to put together. These are bullets that destroy tissue and everything in their path. One bullet from one of these high-powered rifles can create severe damage 3 to 4 inches along the trajectory of the bullet. And that's just one bullet. These bullets explode bone, they shred organs, so there is nothing left to repair. They create shock waves that destroy the body. They kill, which is the only purpose of these weapons of war. As doctors, we work with our teams to put patients' lives back together. We have social workers that get them wheelchair ramps in their homes after they're paralyzed. We see a lot of these every week. Mental health services to help them with their PTSD. We see those every day. Physical therapists to help them adjust to the new ways of life. Months and years of post-injury doctors' visits. This actually happens out of the news that are usually grabbing headlines. We all work together, but we need help. We can't do this alone. We need to work to strengthen our nation's gun laws, including a ban on these high-powered assault rifles. When a trauma patient comes through our doors, it's noisy and messy. You take a quiet moment to assess the situation, determine your priorities, and get to work. I urge our community members and elected officials to drown out the noises saying that we can't do this. President Biden's gun reform measures, passing those is important. Let's get to work prioritizing our lives over guns. Thank you. The next speaker is Avik Das from the Joint Advisory Council.
Thank you, Doctor. Good morning, everyone.
Good morning.
Thank you, President Preckwinkle and Senator Durbin. I also want to thank the great representatives of Cook County Health and the Medical Examiner's Office who are joining together to mark the beginning of Gun Violence Awareness Month with this day. The recent tragic mass shootings in Buffalo, Uvalde, and Tulsa have once again brought national attention to one of the most critical issues of our time, gun violence. Sadly, in the city of Chicago and Cook County, we sometimes see the number of gun homicides that would qualify as a mass shooting in just one weekend. Family, friends, and neighbors are gone because of gun violence. Many others have been lost to jails and prisons because of guns. We are here today to acknowledge the problem, to honor the victims and survivors, but also to discuss real solutions, hopeful solutions, the steps we are taking to address the epidemic of gun violence. Gun violence is a complex issue fueled by systemic problems such as segregation and lack of access to health care and economic opportunity. Gun violence is cyclical, resulting from and causing trauma for individuals and entire communities. But despite its complexity and persistence, with solidarity, we know gun violence is preventable. Researchers from University of Chicago, Northwestern University, across the nation have studied gun violence prevention programs and found they deliver tangible results. Programs for young people and adults that leverage strategies such as case management, counseling, employment services, outreach, decrease the likelihood participants are involved in gun violence. When people's mental and physical needs are met, they are safer. When people are supported, we are all safer. Just as important as research is the feedback we get from community. Residents who live in our neighborhoods that are most impacted by crime and violence echo the need for programs and services. Those who have participated in programs often describe their experience as a turning point towards safety, stability, and success. Understanding that these life-saving programs are effective and community affirmed, we have a duty to make them available to all who can benefit from them. Under the leadership of Board President Tony Preckwinkle, with the support of the leadership here, including Senator Durbin, the Cook County Justice Advisory Council is working to make this a reality. The mission of the Justice Advisory Council is to promote equitable, human-centered, community-driven justice system innovation and practice with stakeholder engagement, policy work, service coordination, and grant-making that increases community safety and reduces our reliance on incarceration. So this summer, we are focusing on grant-making as we prepare for the county's American Rescue Plan Act-funded gun violence prevention and reduction grants. Later this month, we will begin to announce the recipients of these grants. This grant opportunity, which will bring over $65 million to the county over the next 3 years, has been designed as a robust response to high levels of gun violence we have experienced since the onset of the pandemic. We look forward to sharing more information about this transformative grant opportunity and the exceptional programs it will fund throughout the summer. We are proud to be investing in programs that are evidence-informed and community-affirmed, programming that will make communities safer by addressing the causes and risk factors for gun violence. We are proud to be partnering with organizations doing this important work and are grateful for the expertise and dedication of their staff. I want to again thank all those here today that share our commitment to investing in effective, sustainable, and equitable solutions to gun violence and drawing awareness to this work. This weekend, we invite you to join us in wearing orange as a sign of unity and shared commitment as we work to end gun violence. We hope to invite you to join us in wearing orange as a symbol of hope. Thank you.
Thank you, Nick.
There's a group of bipartisan senators that has been meeting to discuss all the elements. I have to tell you, it's a very modest agenda, but I'll accept anything at this point that'll save a life. All that's been reported in the press is the red flag laws, which basically would identify people who are exhibiting conduct that leads people to believe that they shouldn't have a firearm or shouldn't be in certain conditions. So far, that's the only measure that I've heard of, but I hope others are being considered.
So the question is, what would we like to see done at the state level? We thankfully live in a state which has sensible gun laws. Unfortunately, we're surrounded by other states where that's not the case. And there is a pipeline from Indiana into Chicagoland of illicit guns that is one of the things that fuels the violence here. So I think we have to not only look at our own laws in the state of Illinois, but what we can do at the national level to try to ensure that there is more uniformity. As long as it's easy to get guns in Indiana and to bring them in the back of your trunk and sell them on the streets of Chicago, we're going to have tremendous problems, even if we have strict gun laws in Illinois.
I agree with that. I'd add two things. Last year, Chicago was grief-stricken by the killing of the Chicago policewoman Ella French. I went down to her memorial service at Rita High School. There were blocks and blocks of uniforms of men and women waiting to pay their respects. She was the victim of what is known as straw purchasing. A person went into a gun store, showed that they had no criminal record, purchased the firearm and turned it over to a convicted felon who killed Officer French and seriously wounded her partner, Mr. Yanis. It's an indication of what we consider at the federal level to be a bookkeeping crime, straw purchasing, which turns out to be a deadly crime that should be treated as such. In addition to that we can do much more when it comes to tracing the guns that are used in crimes in this city and across the country. We have not had a director in Washington of the Alcohol, Tobacco, and Firearms Agency for 7 years. If you think that's an accident, it's not. It's a conscious strategy by the gun groups to make sure that this agency is not led by a professional who can use all the resources effectively. So by making straw purchasing a serious crime, by filling this position at ATF, be 2 steps in the direction of reducing gun violence. Well, this Wear Orange, as I said, was an annual event which frankly should be viewed in a much different context. As was said earlier, we've had over 200 mass shootings this year. It isn't as though we're going to pick a day or a week or a month about gun violence. Gun violence is a constant in the United States of America. I'm embarrassed by that. I'm enraged by that. And I think it's important that the American people step up and say enough. If an orange tie is a reminder, I'll wear one as often as possible.